When you glance at your teeth, do you ever wish they could be more outstanding? Whether it's replacing a missing tooth or a few to give you that grin that really sparkles. If so, dental mini implants might be your path to a smile that makes you happy. Here to tell us about these bite-sized game changers, we've got Dr. Andrea Joy Smith, who will be coming up to tell us about mini dental implants. Right now, you're looking at a few before and afters, and you can just see the difference in the befores and the afters. So here to tell us all about it, none other than Dr. Andrea Joy Smith with Smile Again Now. Hi, Dr. Smith.
Good morning, Desiree. How are you this morning?
I'm doing good. I'm happy to be chatting with you. I mean, the teeth, it makes that first impression. It's the first thing we see when we look at somebody, when we smile. So let's start with the basics, Dr. Smith. Why is it crucial to get those routine checkups with our dentist?
It's very crucial because often dental problems are not symptomatic, like periodontal disease, and patients can actually lose teeth long before they have a symptom if they have a lot of bone loss. And the other good reason is your oral health is really a gateway into your general health. And so there are things that can be displayed in the mouth that can indicate that there's other general health issues going on. So when you visit your dentist, not only are we looking at those teeth, but we're examining your tissues and we're doing a complete exam just to make sure that there's no other things on the horizon that could come up.
Yeah, making sure you guys check out everything. And Dr. Smith, since it's important to get these routine checkups, what do you think holds people back from hopping in the dentist chair a lot sooner?
Yeah, I actually think that the thing that most keeps patients away from the dentist is that dental fear. A lot of patients, like those before and after photos that you showed, those particular patients stayed away from the dentist mainly because of fear. And it was because they didn't feel like there was a solution for them, or perhaps they had gone to another dental office and they felt that there was no answers for the problems that they were experiencing. And so they were fearful that by going to another dentist, they're just going to hear the same thing and be told that they're not candidates for implants. But all of these patients that you see here were indeed candidates for the one-piece small diameter implants that we do here at our office.
Yeah, so tell us more about that. Tell us, how do you and your team ease the nerves of your patients when they're coming in for a procedure and the procedure that you offer?
Yeah, we first just kind of sit down and look at them eye to eye. And long before we even look into their mouth, we talk to them about their journey, their dental journey. Sometimes it's a personal journey. There's all different motivations that patients are finally coming into the dental chair. So once they're comfortable that we care more about who they are rather than just jumping into the mouth, then they get a little bit more relaxed. And then on top of that, when they do decide to go through with treatment, we offer sedation dentistry. I probably sedate patients 3 to 4 times a week that need dental implant treatment, extractions, and sometimes just a lot of general dentistry. So there's things that we can medications make them forget.
There you go. And the procedure's
Yeah.
already done. And I like that you mentioned for your patients, you like to get to know who they are, what are their needs and wants before hopping in and determining what procedures need to be done. So, Dr. Smith, who would you say
Exactly.
makes a good candidate for mini dental implants?
Yeah, a good candidate is a patient that's been wearing a denture for a long time because we have these small diameter implants that are one piece, and patients that have been wearing dentures for a while, they have often lost the bone that used to be associated with their teeth. And so if they have dentures that are loose and slipping around, we can easily stabilize those dentures so that they are more comfortable. The other good patient that's a good candidate is just someone that stayed away for a long time. They don't want a removable denture option. They're looking for something that's fixed, that doesn't come in and out, and their entire dentition or all of their teeth really need to come out. And they've been told that before, but they've hesitated because they haven't liked the solutions that have been given before. So those patients that have stayed away for a long time, they know that they need treatment. It's a good idea to come in to see if there are teeth that need to be taken out, that they can be replaced with one-piece small diameter implants.
Alrighty. And Dr. Smith, if you have the time, can you share with us one of your favorite reactions from a patient that you've had? I'm sure you get a lot of good ones.
I get a lot of good ones, and patients often cry. Sometimes I'm sitting there in the chair after we've delivered this new smile, and it seems out of the blue to me, but inside of them, there are emotions that are really welling up. And so when I give them that mirror and they see their teeth for the first time, they cry,
Mm,
they hug me, and they really are so happy that they're able to put that part of their life behind them, that part of not having healthy teeth or a
yeah.
confident smile. So the cries and the hugs are the favorite reactions that I get.
There you go. You're making them smile again now. Dr. Smith, always a pleasure having you
Absolutely.
on the show. I'm going to let our viewers know where they can go for more information. You can find out more by going to smileagainnow.com.